Good morning. Bob Ravenscroft, Vice President for Advancement here at Bryan Health for our September 10th, 2020 media briefing. We have a special guest with us today, Dr. Joel Greisen. He's a native Nebraskan. Humphrey, I didn't ask you, is it Humphrey St. Mary's up there? Or St. Francis, yeah. They play some basketball up there usually. So anyway, a native of Humphrey, graduate of the University of Nebraska here in Lincoln, did his medical school at the University of Nebraska Medical Center, and then his advanced training was in a joint program for pediatrics at the University of Nebraska Medical Center and Creighton University. He has been practicing in Lincoln here for the past 22 years. And he's a managing partner of the Lincoln Pediatric Group. He's going to share with us, after I share our COVID-19 statistics, some information on influenza vaccines and the importance of it in the midst of a pandemic of a respiratory nature. So real quickly, as it relates to COVID, and our inpatient census, we had 466 patients at midnight here. We have now tested 22,056 individuals. Still amazes me. Positives are now at 2,454, and we currently have 127 pending results. Turnaround time is still great. I just know that at our drive-through yesterday, we had over 90 people register yesterday and get tested, so that's a big driver of that. We have 14 COVID-19 positive patients in the hospital. 9 are from Lancaster County. There is one additional patient in-house that is clinically presenting, but we're pending. The result is pending, and they are a patient from outside of Lancaster County. Of those patients in-house, 2 of them are in the ICU, 4 in progressive care, and 8 in general care. With that, I have some additional announcements related to flu shot opportunities within the Bryan Physician Network, but I'll save those for after Dr. Greisen presents. So without further ado, Dr. Greisen.
So Bob, I want to thank you for the opportunity to come and speak with you all today. Again, my name is Joel Greisen. I work with the Lincoln Pediatric Group and have been there for the past couple decades. So I was asked today to talk a little bit about influenza vaccination in the community, and particularly with relationship to pediatrics. We know that it's important, especially this time of year and in the midst of the SARS-CoV-2 pandemic. But it has always been universally recommended that all kids and all age groups get their annual influenza vaccination. But this year in particular, it's being recommended that kids receive their influenza vaccination before the end of October. And for those that have never had influenza vaccination, that they receive 2 doses within that time frame. So. And that includes, really is for those that are under 9 years of age. So it gives limited time for those to get their 2 vaccinations with a month's separation. We don't know this year what influenza will be like when it comes to the flu season. We suspect that with the precautions that are currently in place with masking and social distancing and hand washing, that it may push the flu season off a little bit into December, the early parts of 2021. But we do know that if we don't take these measures and do it as a healthcare community, that we do run the risk of overwhelming the healthcare system. Once again, a little bit of what we had seen in March and April when this all started. So I think that's especially important this year, that we take those measures and again work together as a healthcare community to instill that.
Dr. Greisen mentioned try to get these by the end of October. There was a provider call with the health department last night, and that's going to be a community-wide messaging point. Try to get them all by the end of October. Opportunities here at Bryan, a couple of things to share with you. If you're an established patient with any Bryan Physician Network primary care office, you can get your shot through them, so go ahead and call them. At our Family Medicine of Lincoln practice in the Bryan Physician Network. They are having special flu shot clinics for their established patients. So if you are an established patient there, go ahead and get scheduled. And there's also value of MyChart. I know that you've read a little bit about that, and we've been promoting it heavily. It's a way through an app to take care of your own medical record management, and you also receive announcements like the flu shot clinic from Family Medicine of Lincoln. So download the Bryan MyChart app and know that's an opportunity. If you're not established with the Bryan Physician Network office to get your flu shot, please turn to your family physician or one of the many local retail options. But the important date is try to get it before October 31st this year.